welcome to my channel. So this video is especially for baby boys, mothers, parents or caretakers, etc. So other than that, I have created two videos for especially baby boys parents. But those videos are in Hindi. If you're Hindi viewer, you can watch them. The first video was how to open baby boy's private part, where I explained very well the glands, the foreskin, and how to open baby boy's private part, and in what situations you have to visit to the doctor. And after that, if in case the private part is not open timely, then in that case I have created the video on circumcision. That's a very detailed video. I mean how the circumcision is done in the hospitals. Now this third video is also on the private part, which is very important. But you can see, like, just below the baby's boy's private part, there is a kind of pouch that's of normally dark color than the usual skin, and that's called scrotum. In short, that's called sac. Sometimes parents call that sac. So in that scrotum, there are usually two balls. That is absolutely normal. But what happens in some cases, like 1 out of 25 cases, there is sometimes only one ball is present in the baby, or sometimes both the balls are not present in the baby. So being a parent of baby boys, so you should aware that you have to check baby's balls. In case the baby balls are not present in the scrotum, then definitely the scrotum would be completely flat. What I want to tell here, that it's your duty to check the scrotum. In case suppose you are a first parent and you are not aware, then it's your duty to confirm from the doctor and to ask them to check the baby boy's scrotum as well, and to check that the both balls are present in the scrotum or not. So, like, whenever the baby is born, there is a process of physical examination of the newborns in most of every countries. Like my baby was born in UK, and there is a process of physical examination where they examine eyes, ears, and the heartbeats and hip joints. And if there is a baby boy, then they do check the balls in the scrotum as well. One more thing I would like to tell you, like, the balls here, I'm using the term balls, but actually the scientific term is testes or testicles. So what's the role of those testicles in the scrotum? Testes normally store millions of sperm and produce millions of sperms. So, but this functioning is only possible in the scrotum. Why so? Because testes need lesser temperature than body's temperature. And for your information, the scrotum's temperature is lesser than body's temperature. That is 2 degrees lesser. So suppose body's temperature is 37 degrees Celsius, then scrotum's temperature is 35 degrees Celsius, and at this temperature, lesser temperature, the testes would be able to store the sperms and would be able to produce the sperms. Now we talk about, if testes are not present in the right place, then what? Then the testes would not be able to do their functioning. In that case, the sperms may damage because they are not able to produce and store the sperms. The sperms may damage, and if for the longer period of time the testes are not brought up to the scrotum, then in that case there is chances to have infertility in your child in future. And second thing, there is chances to develop cancer in that particular testes which is not into the scrotum. So friends, please take care. As soon as the baby is born, consult with your doctor, and or in the physical examination, just check if the testes are present in the scrotum. So if in case testes are not present in the scrotum, what the doctors do, they normally first suggest to wait till 6 months, because in maximum 6 months after the baby is born, the testes may travel up to scrotum in some of the cases. I would tell you in what cases, in which cases this basically they travel to the scrotum. What's the actual process? Like when the mother is pregnant, then during the last trimester, what happens, they travel to the scrotum. What actually happens, the testes develop in baby's tummy here, and during the last trimester they travel to the scrotum. But what happens in some of the babies, like one of the ball travels to the scrotum but other does not. Suppose this ball travels to the scrotum but this does not, this stucks here, and But sometimes both the balls travels but do not reach up to the scrotum. They get stuck just above the scrotum. So it may happen in some of the cases. So in those cases, what the doctors say, just wait till 6 months. Maybe naturally the balls would come to the scrotum. There would not be need any surgery. But in after 6 months, if the balls do not travel into the scrotum, then there would need a surgery. So friends, what happens? I tell you, in premature babies, the balls normally travel up to the scrotum naturally. In most of the premature cases, after the baby is born and has completed 6 months, you may see the ball has come naturally to the scrotum. But in other cases, there is very less chances that the balls would travel up to the scrotum. So friends, what the doctors do in this surgery, they would be bringing the balls to the right place, that is to the scrotum. If you delay this operation, ideal age of this operation is 6 months to 12 months. I mean 6 months to 1 year. If you delay this operation, then there are chances to damage the sperm more and more, and there is chances to develop the infertility more and more. So what I want to here communicate is, don't delay this operation. Just consult with your doctor and have the necessary steps soon. One more thing friends, the testes which are present in the scrotum, they are called as descended testes, means those have been descended to the scrotum, and the testes which are not present in the scrotum, those are referred as undescended testes. So friends, this was my complete video. If you like the video, please hit the like button and share it to the people please who actually need it. And if you really like this video, please subscribe to my channel so that you will be able to see my further videos. Thank you friends. Thank you for watching.